Moving from the nasal cavity into the pharynx, we're going a bit posteriorly. Now, we've mentioned in previous videos about the pharynx having different regions. The superior aspect of the pharynx corresponds with the nasal cavity and the mouth, while the inferior portion of the pharynx is heading down into the esophagus itself. So we're looking at kind of that region just in the back behind the nose, behind the mouth, just behind the chin area. Now you can see here, we're looking at the three different colors. The top, the green, that's representing the nasopharynx. That's what's just posterior to the nasal cavity. While the middle, that blue, is just posterior to the oral cavity. And the purple below that is heading down past the mouth, leading down to the trachea and the esophagus. But keep in mind the tissues present. What's the lining of all these? If you're looking at the top, this up top is all pseudostratified columnar. Why is it pseudostratified columnar epithelium? It doesn't need to be protective multi-layers. The air you're inhaling, is it sharp? No, it's air. But if you move down then, down to that area that has the stratified squamose, both the oropharynx and laryngopharynx, in that case, things that you eat can come into contact with both those regions. So they could potentially be a little bit sharper. Think hard pretzels or crackers. You say, well, you chew them up. True, you chew them up. But do you always mash every single piece perfectly? Probably not. So there are a couple pieces that can be a little bit on the sharper side. You're protecting yourself by having multiple layers. So it's changing from that simple single layer, that's pseudostratified, one layer, down to the stratified, which is multiple layers. Now, you've seen this view before. Just keep in mind, this is where we're focusing on. That nasopharynx, the oropharynx, the laryngopharynx, that is the pharynx. The three different regions of the pharynx. All right, below that now is the larynx. The larynx is what's coming just after that. The larynx itself is the opening from the laryngopharynx. So it's just after the pharynx. You have the hyoid bone there just up front. It's just up, remember, underneath the chin area. What's it doing? One of the biggest things, patent airway. You're saying, what's a patent airway? It's a continuously open airway. Your trachea, we'll get to in a little bit, your larynx and your pharynx are always opened. That means air is simply just passing on through. It doesn't have to push through anything. It's a continuously open space. Now, in contrast, for example, the esophagus behind it, where the food and liquid goes, that collapses down. That's a muscular tube that collapses. The food and the liquid gets pushed through there. In the airways, you can't do that because there's not the same amount of actual mass to the air. So the air is always flowing through these open airways. Routing air and food, I mentioned that already. Sure, make sure that the air goes to the lungs, food and liquid goes back into the esophagus. And voice production. This is depending on how the person's voice is, their base of their voice. Is it deeper? Is it higher? What voice do they have to start with? Sure, the nasal cavities can form and shape the sound. Your lips form and shape it. But the base sound is formed down in the actual larynx. Now, in the larynx, the cartilages. Hyaline cartilage is predominant, except for the epiglottis. We'll get to that one in a second, the epiglottis. The thyroid cartilage is a certain sheet of cartilage, and that's made out of hyaline. The cricoid cartilage also made out of hyaline. But then the epiglottis is made out of elastic cartilage. It's elastic because that epiglottis is folding over every time you swallow food or liquid. And the purpose is to cover up the larynx. You're basically preventing and making sure that that food and liquid doesn't go down towards your lungs. So here's the anterior view of the larynx. You can see the hyoid bone is up top here. The red thing in the back, we'll get a better view of that, but that's the epiglottis, just the very tip of it sticking up. Then you have your thyroid cartilage right here in the middle. That thyroid cartilage is also what forms the laryngeal prominence. Maybe you've heard of it from its other name, called the Adam's apple. It's what sticks out the throat, the laryngeal prominence. Cricoid cartilage is what you have right there. It's the sheet of cartilage just inferior to the thyroid cartilage. And then you have all these tracheal cartilages, known as the C-rings or the cartilage rings. They are C-shaped because they go around the front, but the back is always opened. So these C-shaped cartilage rings going all the way down the trachea. So the tracheal cartilages. From a lateral view, this is the right lateral view to be precise, you can see the entire epiglottis here. Now remember, that epiglottis is made out of elastic cartilage for flexibility. But when that folds down, that's going to fold so it covers this entire space. It's meant to block the space. Well, you're also seeing, this is your thyroid cartilage. You then have your cricoid cartilage. You can see it down there. And then you get down to your C-rings or your thyroid cartilage below that. And those continue all the way down the trachea. The purpose of all this cartilage is to keep this airway opened, prevent it from collapsing down. The cartilage maintains the shape. All right, in the larynx, you also have the vocal ligaments. So I'm going to slip back to that last slide because we didn't quite talk about these for a second. But these things are elastic fibers, and you have your vocal folds to start with. So going back for a second, the vocal folds are right here. The vocal folds are going to be inferior or just under the vestibular fold, which is right up here. Now, the vestibular fold is known as your false vocal cords. The vocal fold is known as your true. That's because the vocal folds are what contain your actual vocal ligaments. So what happens is there's an opening between your vocal cords. So these vocal folds. They're made up of these elastic fibers, and below them and through the middle of them is the glottis. That's where air passes when you're exhaling and inhaling. But if you're trying to produce sound, you close down those vocal cords a little bit, and therefore the air that travels through them causes them to vibrate. As they vibrate, that's what creates the sound, the vibration of your vocal ligaments. The more air you pass through, the louder it would be. The less air, the quieter. Depending on what pitch you're trying for, a high pitch or a low pitch, you can change how tight or how loose those vocal ligaments are. So you're controlling these vocal ligaments in your vocal cords to produce your sound. How they vibrate is what you're controlling. Now I mentioned the vestibular fold is going to be the false vocal cords. They have nothing to do with sound production. Basically what they do is they help close the glottis during swallowing. They kind of push things through and make sure that that glottis is closed down and nothing is getting through. So kind of think of it as helping prevent food and liquid from passing. So with the epiglottis, the vestibular folds are also helping out, preventing entry of food and water into the lungs. So again, another view here just to show, you're looking at your vocal folds right here. Vestibular fold is superior to that. So the two things you're looking at there are just side by side. Vocal fold is low, vestibular fold is high. Or true vocal cords, false vocal cords. Looking from a superior view down, this white, that is going to be the actual vocal ligaments. So that's your vocal fold. You can notice over here, they're closed. So when they open up a little bit, it depends on how much you open them as far as how tight they are, and it controls the vibration. Now that's an artist's rendition, obviously. The real thing is this. Now this is actually from a cat, so it's not human, but similar ideas. You can notice right here, those are the vocal folds. Just superior to it, that's the vestibular folds. This is the epiglottis, just above it. That epiglottis would come down and cover that upon swallowing. So your vocal folds, your vestibular folds, epiglottis, all these parts play a piece at helping how you breathe and helping how you vocalize and create sound.